Welcome to the June 2025 webinar, Parkinson's Disease and Occupational Therapy by Abby Miller, our wonderful graduate occupational therapy student. She is completing her capstone project with Parkinson Foundation, Western Pennsylvania, and then she will pursue her licensure in occupational therapy. She just graduated with her doctorate in occupational therapy from Carlow. And I'm Casey Peluso from PFWPA and VP of Programs and Outreach. And I'm delighted that you're joining us today, either in person or at a later time. And thank you, Abby, so much. I'll hand it off to you, Abby.
Righty, thank you. I'm excited. Clearly, I love occupational therapy. Decided to go to school for it. And I really got started in this because my grandmother had Parkinson's. So this is definitely a topic that touches close to home. So here we go. Parkinson's disease and occupational therapy. We'll talk a little bit about enhancing quality of life through functional interventions. And I am Abby Miller. There we go. All right, so just a quick introduction to Parkinson's disease. I know most people will have a pretty good base knowledge, but just in case anyone didn't, I didn't want to leave anyone hanging. So Parkinson's disease is a progressive neurodegenerative disorder that affects movement and coordination. Some of the primary symptoms are tremors, rigidity, bradykinesia, which is the slowness of movement, postural instability, that like feeling like you're falling backwards or forwards, core strength, things like that, fatigue, and then some of the secondary symptoms or like some of our non-motor symptoms are the cognitive decline, mood disturbances, and sleep disorders. So some of the causes and risk factors we have, it's caused by a loss of dopamine producing neurons in the substantia nigra, and that is the part of the brain that plays a crucial role in movement, reward, and other cognitive functions. There's also a loss of the norepinephrine, which is linked to some of the non-motor movements, non-movement symptoms. So the risk factors for this is people who are usually 60 plus, although we do have growing numbers in the young onset Parkinson's disease. And so those are people diagnosed before 50 years old. Another risk factor that I didn't list is being a male. They have a higher chance of getting Parkinson's disease compared to women. But we believe right now that there's a combination between genetic and environmental causes. And so that just means that we're still looking to see what the reason is, but right now we believe that there's a genetic link that's stronger in the young onset Parkinson's disease, but it's still being researched. But we definitely do know that there are some environmental factors like the pesticides, herbicides, heavy metals, and welding exhaust, some viral infections, and head injuries that can be linked to the cause of Parkinson's disease. So the role of occupational therapy and where I come in as a therapist is to help maintain and improve functional independence and quality of life in a person, whether you have Parkinson's disease or any type of other disease, or just no disease, honestly. But what I was talking about earlier was specifically Parkinson's disease, but the rest of what we'll talk about can be used for someone who was diagnosed with Parkinsonisms. So those are a little bit different with the risk factors and the cause. They can be caused by different things, but the rest of what we'll talk about can be shared between someone who has Parkinson's, Parkinsonisms, dementia. Each person is different. And Parkinson's disease is one of what we call a snowflake disease. And that is meaning that everyone is a little different in how they show. And so what I'll talk about here today will be what I have come up with. That's pretty general. But just take that with a grain of salt that this won't be directly what an OT would prescribe for you, because they would come in and help you to They would take a look at your life and assess your habits, routines, roles, and rituals, and find out what's meaningful to you and what can be helpful to you. So some of the focus areas for occupational therapy are your activities of daily living. And a lot of us know this from maybe a hospital stay or going to physical or occupational therapy. But for those who don't know, occupation or activities of daily living include your bathing, toileting, dressing, eating, bringing the food to your mouth, some of that functional mobility. So going from the couch to the bathroom or the bathroom to the kitchen, and then like hygiene. The instrumental ADLs or activities of daily living, that's your care of others or the managing, having someone come in and care for yourself. It's also the care of pets, your ability to communicate, giving and receiving, driving or just community mobility, whether that's public transportation or whether you're still driving, some financial management, just general home management, being able to do the dishes and the laundry, meal preparation, and then things like shopping, having to go to the grocery store, the part of getting there, creating the list for the grocery store, the act of picking up the groceries, and then bringing them into the house. We'll look at some environmental modifications and how that can support occupational engagement. And the term occupational, I guess I should have said, does not mean work. I know sometimes people are like, what? I don't have a occupation anymore. But we talk about, oh, your guys' faces just went over my screen. Sorry. We talk about occupations, just referring to the things that we do each day. The term occupational therapy stems from the belief that people engaging in meaningful activities or occupations can be therapeutic for people with various physical and mental health challenges. So that's what I'm talking about when I say occupational engagement. It's how you engage with the things that you choose to do. We'll look at some health management, so mental health, symptom management, fatigue, things like that. Cognitive strategies. With Parkinson's disease, we start to have some trouble with the dual tasking, so walking and talking, eating and listening to music, things like that. Memory and then sequencing. We have people who have freezing episodes, and so some of that sequencing, the ability to take that next step can be impacted. And so something like that, we may use visual or, we may try to provide some more visual or spatial information needed. That way you can navigate through the doorway. This might look like a piece of tape or creating some type of runner so that it looks like there's no break in the door, because your perception can be off. And so it might be something as little as adding 2 pieces of tape just to keep your body moving. But it's also, if that doesn't work or if you're out at the store and have to go through a door, it's teaching strategies like the 4 S's, which is the stop, sigh, shift, and then take a step. So whether it's something physical that we're changing or some type of, mental strategy, we're going to look at trying to fix that. We'll do some energy conservation or fatigue management and looking at rest and sleep. And we'll look at work, leisure, and social participation. I put those together because a lot of the people we're talking to right now aren't doing work. So a lot of the time we're just looking at increasing the amount of leisure activities that we do and social participation and doing the things that you used to want to do. There may be an added element of depression or apathy. And so we want to make sure that we don't completely pull away from society and isolate ourselves and just stay in the home. We want to make sure that we're still doing those things that make us happy, that stimulate our brain and body, and get out there in the world. So we'll go a little bit into that. I just wanted to put this in here. We won't really go through these, but OTs do have assessment tools that are standardized, and the COPM is my favorite one. It has the person rate themselves on what is important to them. So their ability to drive, or their ability to go to the store, do laundry, how important that is to them to continue doing. And then at the end, we look at how they feel like they are completing that task. Do they think they could be better at it? Is that something we need to work on, or do we need to move on to something else? So here are just some common tools if anyone needs to reference these. Dexterity and coordination tests, that's for the hands. But yeah, we're not going to go really into those. I think this one's a good one. We have multiple models. Every discipline has models that they follow. This is the model of human occupation, and I think this is a good one, a good visual. And so you have your environment. So that's where you live, or where you complete your work, or whatever activity you're doing. And then you have your habituation, which is like your roles and routines. So I think an example that I could give you would be, say your environment is the steepest hill in America over in Beachview, and your habituation would be going on walks. You enjoy walking, but you live on the steepest hill. Your performance skill is going to go down because that is a very challenging hill to continue to walk. It's not paved, there's no sidewalks. And so your volition, it's going to decrease your confidence in your ability to do something. So if your environment doesn't support your activity, then you're going to feel worse about yourself, and you're not going to trust that you can complete something. And so that's the model that we use coming into someone's home, or looking at their activities. We look at, is the environment supporting the activity that you're completing? And then we look at your skill set, and if you're able to complete those. And so the hill situation, if we were to modify that, we would say, can we change the environment because we're on the steepest hill in America? Can we go to the bike trail? Or would that, impact, that would impact your performance skills because you're walking on paved sidewalk in the shade, flat ground, so you'd feel more confident in completing that type of thing, that type of activity. But I just thought that was a helpful visual for how a therapist would come into your home and try to look at things. All right. So here are some of our therapeutic approaches. And I think this is also just helpful so that you know how we're looking at you as a person. We're not just coming in and trying to change everything. We're looking at, do we need to create and promote something? Are we trying to maintain a certain skill set? Are you able to do the dishes right now? We want to make sure that we can maintain that skill. Or do we need to modify something because it's becoming too difficult and you're not able to do it, and so your caregiver is taking over? I think an example here would be driving. We can, every activity that we do can be broken down into different skills. And so for driving, we want to, and wanting to maintain this skill, we're looking at, are we able to physically get into the car? Is it cognitive, or is our reaction time not there? Are we able to manage multiple things at once? You're driving and visually scanning the road. Are we too drowsy to be driving safely due to medications or not getting good sleep and rest? And so there's a lot of things to look at within that one skill of driving. that we can look at and break down to see whether we need to establish and restore, maintain, modify, or prevent. So we'll go over some of what we would call creating and promoting. And I just came up with some general examples that I have heard or talked to clients with. And so these are just little ideas, but you can take a look at your own life and think back and see if there's anything that you can create or promote in your own life. And so with Parkinson's disease, we talk a lot about constipation due to the side effects of some of the medication. And that can lead to some bladder incontinence. But we also have some slowness and potentially some orthostatic hypertension. And so we don't really want to be, and we might not be able to jump up and go out of bed, get out of bed when we have to use the restroom. So creating a plan for these occasions, it might be putting a $5 CVS urinal by the bed or by the couch in case you're sitting in the couch for an hour watching TV and all of a sudden you need to use the restroom and you're not able to get up fast enough. We want to make sure that we're putting things in plan just in case there is some type of an emergency and you're not able to get there quick enough. Because we don't want that leads to fall risks and, we don't want to end up on the floor. Or we can do some creating routines. Routines are really good for people with Parkinson's because of the slow digestion, and really routines are good for everyone. It's good to get up at the same time each day and go to the bed at around the same time. It's good to eat your meals at the same time. It helps your body get into a rhythm. Especially for someone with Parkinson's who's taking medications on a scheduled basis. And so an OT can help someone create a routine, whether it's planning out small meals throughout the day, taking medications on time. There's a million things that we can do, but that's just another idea of what we can create. Some promotion would be promoting occupational engagement by developing fatigue management programs. We have a ton of ideas for fatigue management, and this is a huge symptom that people deal with on the daily, and fatigue is no fun. And so some of our tips and tricks for fatigue management is gathering items before the activity, whether that's meal prep, getting dressed in the morning, going outside and, sitting on your porch, whatever the little activity may be, gather everything that you can, place it there, and then you don't have to get up and get back down. You're not like looking around, trying to figure out what you need. It's just create a plan and then gather those things. Pacing yourself, so stopping before you fatigue. And yeah, really that's it. Stop before you fatigue out. Try to make that plan for your day. If you wake up in the morning, create a daily schedule so that you can take breaks, have scheduled breaks throughout the day. And prioritize necessary tasks. If you know that you feel better at 11 o'clock a.m. than at 2 p.m., try to get some of those necessary tasks done in the hour of 10:30 to noon, rather than pushing it off until 4 p.m., something like that. Something that you can establish and restore within your daily life would be establishing a morning routine so that you can get to school or work on time. And maybe it's not school or work, but maybe it's church, or maybe it's, whatever you have going on in the day. Maybe it's a store. And I think it's taking a step back and looking to see if you really need to be somewhere by this amount of time, or if you're adding additional stress. Try to try to take away as much stress as you can from yourself. So hopefully you're not rushing, because we want to keep your mental health good, and we don't need added stress. Parkinson's patients have enough stress on their shoulders, I believe. Something that we can restore is restoring confidence in your ability to complete tasks. And this might be with the use of cognitive strategies. It can be kind of painful when you're frustrated in yourself and you're trying to come up with things that used to be second nature. A lot of those autonomic skills, like the swallowing and blinking, those decrease, but so do some of our memory and sequencing abilities. And so creating lists and calendars and having sticky notes around the house and using alarms to tell us when we need to take the medication, it's not giving into, it's not people giving into Parkinson's disease. It's utilizing what you can to make it so that you're not as stressed, or we just want to make sure that you have what you need to be successful in your day and stay functioning. This is some of our maintenance. And so maintaining skills through adaptive equipment, strategies, and exercises. For people who are still maybe single or have to do a lot of the home maintenance things by themselves, some of this adaptive equipment is going to be really helpful in the kitchen and in the bathroom and all over. I picked all kitchen things, it looks like. So, we have the adaptive utensils that have the turned the turned fork so that it can get into your mouth easier. This one is a chopping board, but you don't have to actually hold the food. It goes on those little nails, and then you can cut. But you can also do some maintenance with exercise. So if you're used to carrying the laundry from your laundry room to your room, then we want to make sure that you maintain those muscles. And so we're going to be working out your shoulders and your arms and your legs and your core to make sure that you can maintain that skill. Some of the things that we would modify. This is when the skill has decreased to the point where we need to bring something in to help a little bit. Doesn't mean anything bad. It just means we're going to make things a little easier. So this might be completing meal preparation tasks while seated. I think this is a really great tool. It also falls under our energy conservation and fatigue management. It's not wasting your energy standing up and cutting the things and going back and forth between the fridge and the counter. It's bringing everything to the table, sitting down and getting all of it done right there. And then you can throw everything in the pot or whatever you're doing. I think that's a really good one. And people say that it's helped them to feel less worn out after a meal. Adding a shower chair to your shower so that you're not standing there the whole time. Non-skid mats, so that you decrease that fall risk. Long handle sponges so that you're not bending over all the way to try to get your feet clean. And so we just want to make sure that things are safe. Some other things would be like making adjustments to your environment. And that might be the use of a laundry table to avoid bending up and down. It can be tiring to lean all the way down and pull everything up and then throw it in the laundry. Just yesterday I was doing my laundry and I was standing like a couple feet away from my laundry machine, and I'm trying to reach in to grab the clothes. And I stopped and I looked at myself and I was like, why am I leaning over my laundry basket to get to the laundry? All I had to do was move it to the side, and then I had better body mechanics. So I'm not reaching over something and arching my back I'm actually able to get up close to the laundry machine and then reach down in. Now, is it perfect or comfortable? No. I hate having a laundry machine that I have to reach down into, but it's stopping, assessing yourself, and taking a look around and just saying, what is going on here? Because this is something that's movable. I can simply move the laundry basket out of my way so that I can get closer and have a better and safer body mechanics while completing this task. And so that's the same thing that we're talking about here, making adjustments to your physical space. Can you put a laundry table right here so that you don't have to reach down at all? You can just simply have it next to you on the side. Things like that. And sometimes you can't, I have a closet for a laundry room. And so I can't put a table, but there's other things that you can modify and take a look at. That's just a suggestion. And I kind of talked about this here. It's breaking down tasks into smaller steps. And so an example here might be, looking for my slippers. An example here might be, at the end of the night, people tend to be really fatigued. And so after dinner, if it's just you and your partner, are you able to go get into PJs and kind of start your nighttime routine rather than after dinner going down and sitting by the couch or reading? And then when you're ready for bed, you've got to go all the way up the steps. You have to get undressed. You have to find the clothes. You have to brush your teeth, take out your hearing aids, plug them in, go to the bathroom. Is there any way that you can get into PJs or brush your teeth and then go back downstairs and watch some TV? And then when you come back up, you're already dressed and ready for bed, and all you have to do is go to the bathroom maybe. So trying to space out those activities so that you're not doing everything at once. Because if you're doing everything at once, that's where we're getting into that confidence, that moho model again. You're feeling like your environment and your ability to complete the tasks in your environment is decreasing, and it makes your confidence go down, and that impacts mental health. So breaking down things and making it easier for yourself and your body can make you feel better about yourself in your space, which in turn increases your mental health, and we need that. Some of the things that we want to prevent is any type of fall. And so this is looking at assessing your home environment. And everyone knows, every time I talk to anyone, they're like, oh, you want me to take out my rugs in my apartment? And, yes. But also, if you've had your rug there for 25 years, it's almost more of a habit to have it there and safer to have it there than to take it away. But really what we're talking about is some other things. It's decreasing the clutter on your floor. On your steps, do you have things piled up on your steps that you're meaning to take up, but instead they just sit there on the side of the steps? Things like that. We want wide walkways, things that we can't trip on the floor. Is it really dark from your bedroom to your bathroom in the middle of the night? Do we need to add some? On Amazon, there are some sensored floor lights that you can stick on the floor, or like a stick-in night light, just so that you have some light when you're trying to run to the bathroom. A lot of people are like, I've done that walk a million times. Yes, but until the 1,000,000th that's when you have a fall. So we want to make sure that we put things in place before we need them. That way you don't end up in the hospital and you come home with something worse. Some other things we'd like to prevent is constipation. And sometimes you can't prevent that because of the medications and things, but we can do what we can with hydrating and with good nutrition to make sure that we keep our bowels moving, because constipation leads to, bladder incontinence, but also, the medications aren't going to work as well if we're constipated, because it's not getting all the way down into our digestive system. And it's just not good for us. So we want to make sure that we're staying on top of things like that. We would like to prevent functional decline with exercises that may be targeted at body parts impacted by dystonia. And maybe not everyone has those, but those are like muscle spasms. But an OT can help to target those, whether it's in one arm or, wherever it may be, your feet. We can help to strengthen the muscles around it so that to hopefully decrease those symptoms. We can also create some type of tracker or planner or, log to look at the timing of the medication. And that can be shared with the doctor to show, patterns and when dystonia is happening and how you're feeling throughout the day with that medication. It's important that, no one knows yourself like you know yourself. And so it's important to be your own advocate. And that's why we do a lot of writing down our symptoms and how we're feeling. That way you can take it to the doctors and you can show them because, they don't know what's happening at home. And so that's another strategy. And then another thing we want to prevent is isolation. And this may be by encouraging participation in leisure activities for people with apathy. Something with apathy is the importance of scheduling things and, having a plan for it. So, telling your partner, we are going to go meet Tracy and John next Thursday at noon. And then gentle reminders for that week, putting it on the calendar. We are going to go do this. Or asking the person with Parkinson's disease, like, what is our goal for this week? When are we going to get out? Seeing when do we want to go take a walk in the park for us and for our mental health, making sure that we're still including those things in our week, taking a look at your weekly schedule and trying to find some time where you can add in something fun. So some of our strategies for these interventions, these may be some familiar words to you, but we're going to be looking at motor skill training. And so that's your fine motor, but also like the lifting and transferring of items, functional mobility and strengthening, things like that. That's like, are you having tremors while you're reaching for the milk and trying to bring that to your coffee? How are you getting it there safely from the fridge to the counter? Looking at whether we need like some type of rollator or some type of cart, buying half gallons versus full gallons, things like that. Or can we strengthen the muscles to see if we can decrease strain with that activity? Or maybe it's the carrying the mug, it's not a weakness problem, but it's a tremor problem. And so do we need to get, cups with lids? It can be a Yeti or some type of sippy cup. I know people hate the word sippy cup, but we use it all the time in the hospital and nursing home and everywhere. And I mean, I have one right here actually. So sippy cup. But those are just some things. Some cognitive strategies are like the memory aids that we're talking about, and that might be a pill bottle, the pill box with the Monday, Tuesday, Wednesday, Thursday, Friday, or sticky notes around the house. This is how you start the coffee machine. 2 cups, 2 scoops of coffee, half cup, however you do your coffee machine, things like that. Cognitive strategies also include routines because it helps the person to have something to look forward to. And then we'll also look at task sequencing. Some fatigue management that we talked about is the pacing, the scheduled rest, simplifying tasks. This is like breaking down tasks into smaller parts, but also like prioritizing activities based on like essential tasks and what really need to be done. It's, the collecting of the items before we do it and making sure that we're doing things, smarter, not harder. That's the whole idea here. Some adaptive equipment. So that's going to be your weighted utensils, grab bars in the bathroom, sometimes the kitchen. dressing aids, and that's like your button hooks or your sock aid and things like that. Some of the home modifications that you can do can be really small, and that's just like removing tripping hazards. But it can go all the way up to, adding a lift chair or grab bars, or ramps or rails in the home. And so they can be really small or they can get pretty big. And then we're going to look at a lot of symptom management. And that's going to be, for a symptom like not being able to sleep throughout the night, we're going to be looking at creating routines, looking at sleep hygiene, just to decrease those sleep disturbances and fatigue. And that also in turn decreases tremors and rigidity. So here's a little case example. I use John because that's an easy name. He's a 68-year-old male with Parkinson's disease, and his goals are to improve dressing and meal prep. A lot of the times goals come from a care partner. He's spending a lot of time getting dressed in the morning, or he's getting frustrated, or he doesn't want me to help, or I'm just doing it now. And so that's where, or, a person will come to us and say, I'm getting frustrated with myself. It's taking me a pretty long time to get dressed in the morning, and it's taking a lot of effort. And so what our interventions would be looking at, can we modify the skill? Is, the act of buttoning a button so important that we need to really hone in and try to work on the dexterity and figure that out? Or can we simply just buy a $6 button hook and have that decrease the stress and increase ease in getting dressed in the morning? So something like the use of a button hook or reachers, and then some of our fatigue and energy conservation management strategies, like, are you able to pick out your clothes the night before, put them next to your chair, and then when you wake up, if you shower first, or if you just roll out of bed and, move to your chair, you've already got your clothes laid out there for you. And so it's okay if you roll out of bed and then collect all your clothes, shoes, and then put them next to your chair. But either way, once you sit down in the chair, you've got everything you need, hopefully. Socks, underwear, pants, shoes, shirt, the whole thing. And then doing it while seated in a chair. It's impressive to do it while standing, but it's not a good use of energy. And it's also a fall risk. And so it's better to not be stubborn and say, oh, well, I've always done it standing up, I'm going to continue to do it standing up. Well, that's fair, and you can try that. But also we're trying to decrease the feelings of fatigue throughout the day. And this is a good opportunity to just have a seat and try to take a load off, and save some of that energy for later. Meal prep, we've talked about it a few times, but the same thing, energy saving techniques for cooking, is to sit down and do all your prep. But it might be, do you have tremors in your right hand, and are you right-handed? You might need a rocking knife. And so that's a round knife that you can hold on to. And it's a different type of movement than the sawing. Sometimes with the tremors, it can be hard to saw through your veggies, and it can also get dangerous. And so in this example, we're looking at increased independence with daily activities, and then decreased fatigue and reduced caregiver strain. And that's the goal. So with all of this said, it's super important to have a good care team, or a multidisciplinary approach. And so this includes your neurologist, your movement disorder specialist, OT, PT, SLP, social worker. I didn't put it on here, but it is the most important. If you have a care partner, that is your top cheerleader, and that's the most important. But I'm talking about people that you pay. So that's what we're looking at here. But we all have the goal of a holistic care, or looking at the whole person and supporting the patient and the caregiver. And so it's really good to have a good team behind you. I understand that there are some challenges and considerations with all of this, and that is that this is a progressive disease. And so things are going to be changing. And so it's important to stay organized and ready and be accepting of help. There's also psychosocial impacts. And that's your like quality of life and mental health. And so pay attention to it. It's just as important as your physical health. If you drop off in one part, it's not going to be as helpful to have, if your physical health declines and your mental health is amazing, it's not going to be good because you're not going to have the physical in the same way. You've got to keep them. They're both important, is what I'm saying. And then the need for continuous reassessment. This is a progressive disease, and so things are changing. So it's important to stay open-minded and positive. But also, stay up to date on appointments. And if you're having trouble with managing of the appointments, ask for help. But it's also important you have Parkinson's, but you're also a normal aging adult. And we need to stay up on eye and ear appointments. Taking a look at vision. Is it the Parkinson's with the perceptual and spatial challenges, or is it your eyesight that's getting worse? So there's a lot of things that we need to stay on top of, and it's a lot to manage. And that's why we say Parkinson's patients are so busy. But it's important for continuous reassessment. And then cost. I absolutely understand that cost is a huge part of life. And so it's important to utilize the research available or resources available to you. I was just looking last night, and someone that we had at the conference, the Parkinson Foundation conference, was Tech Owl, and they have a assistive equipment library. And so if you have never used a rollator or a walker or a reacher, you're able to take from their library, try it out, and see if you like it before buying it. They also have used equipment that you can actually own, you can take on, but there's a ton of resources that can be helpful. So find out what you qualify for, see what benefits you can get. And then if you have any other trouble, reach out to the Parkinson's Foundation of Western Pennsylvania and see if they can help point you in the right direction for any other resources. But, don't take everything on by yourself is the point here. The conclusion, Parkinson's disease requires long-term and individualized management. And I think that's pretty obvious, but everyone is completely different. And so is every therapist and doctor. So just because one doctor doesn't work for you doesn't mean that another one won't. So stay positive, stay open-minded, and continue to try to do what you can to maintain that function in your life. And then the other one is, OT can help. I think a lot of people don't know what OT is. And so that's why I'm excited to come on here and share a little bit about what OT is, so that we can try to get out there and help the people. Just a little quote that I think was cute. Therapy doesn't cure, it empowers. And so we're not going to come in and fix everything, but we're going to come in and try to help you problem solve through it. Any questions? Oh, Dr. Sherman.
If you have any questions, you can either type them in the chat or you can unmute yourself and ask that way. I really liked how Abby had shared about being smarter, not working smarter, not harder.
I was like, what
That
did I
makes a
say
lot of
about being
sense.
smarter?
Yes, working smarter, not harder.
Yes,
A lot of
I think that's
tips and
definitely
tricks and ways to ease some of the transitions in life during
yes,
your
exactly.
journey with Parkinson's.
Exactly.
Yes. Any thoughts or questions?
Well, I thank you guys for
Yeah,
coming
thank
on
you,
and
Abby.
listening. Yeah.
Very valuable presentation, and hope everyone takes something away from this presentation today on occupational therapy. Thanks, everybody. Have a great afternoon.
Thank you.
Nice job, Abby.
Thank you.
Thanks
Yes,
for
I
for
agree.
coming. Congratulations.
Yeah, she's awesome. Thanks. Bye,
Bye.
everybody.
Bye. Take care.
Goodbye.